Stress management or anxiety. You may have come to this video because you're feeling stressed or anxious, so it's important to differentiate right away the difference between what we think of as general stress and then what I would think of in diagnostic terms as a psychopathology in terms of something along the lines of an anxiety disorder. Stress in general is common and normal and oftentimes can be healthy. Stress, when it's helpful for us, will encourage us to prepare for things or to take actions because we've reached a point where our worry is causing us to act. When things are going well, this can be very productive, help us to study for tests or exams, prepare for projects, take steps to meet deadlines, be they personal or professional. Anxiety, or the more chronic psychopathologic conditions, is really what happens when that level of anxiety is overwhelming to us and we are anxious in times that it is not productive or we are not able to channel this in a productive way. So, some stress is a good thing, and your goal should not be to eliminate all stress from your life. In fact, this would be unrealistic, unproductive, and probably not serve you well in the long run. How do you manage anxiety or stress? You could do a search online and come up with all types of lists. We have some on our Counseling Center website as well. But one thing to determine is if what you're worried about, is it something that you can take action on right now? Is there something you can do to reduce your stress at this moment while you're worried about it? If academic setting will continue with tests or some sort of academic project, if there's something you can take a step on currently, finding a resource, reviewing some notes, something like that, and that will allow you to feel some sense of progress or productivity, go ahead and do that. This type of productivity can allow our anxiety to decrease. If what you are stressed out about is not able to be acted on right now, and there's nothing you can do productively towards that end, it becomes what we think of in terms of stress management, anxiety management, how to either distract or relax ourselves during these periods of times. There are a number of options. One of the most well-researched and kind of in vogue in psychological circles currently are meditation or mindfulness. There are a number of apps that can guide you through that. Most of them are free. That doesn't work for everyone. So stress management can take on really any form for the most part. Exercise when able, physical routines, taking a walk, distraction tasks for the short term. So if there's something you enjoy doing, reading, watching television, TikTok, whatever, the only thing to be aware of is if you're distracting yourself and you're having a problem with recurrent anxiety is avoiding what's known as the cycle of anxiety, to where something is causing you to be anxious, right? And so what you do to respond to this anxiousness is you distract yourself. So let's say watching some video. And so while you're watching this video over here, your anxiety reduces and you allow yourself to forget, and you come back around and all of a sudden you're more anxious because you haven't taken any steps towards what's causing your anxiety. And so this cycle just gets worse and worse, and until you're kind of paralyzed with anxiety is how it's sometimes described. So this anxiety cycle is something you want to avoid. But short term, if you can distract yourself and then find a time later to get back to work, to take action, then it's completely appropriate to take the time to relax. Other strategies beyond meditation, exercise, some grounding techniques. So these can include things like visualizing yourself in a pleasant place, kind of the happy place, so to speak, if that works for you. Taking some time to just slow down your thoughts and focus on anything else. Eating well, taking care of yourself physically as well as mentally. Taking the time to make a plan of action. So SMART goals is something that's objectively measured, attainable, and has a clear timeline. So just really along lines of planning could be helpful. Aromatherapy, some people find helpful. If the stress and anxiety seems like something that is really out of whack or extreme given the circumstances, then that may be a time to consider therapy as an option. So that's something you could certainly seek out as well. And we are available to consult with that as well. So please reach out. We can do much longer presentations. We have a lot more information on our website, and this subject, stress and anxiety management, could be stretched out over an hour or as little as 3 to 5 minutes. So there's a lot of content that just isn't able to be approached in this very brief video. Thanks for watching.